My name is Candace Harper Woods, and I am actually displaying the language of anatomy this evening. Um, we're actually going to go through the body regions and anatomical terminology. The first item that we're looking at here is the hallux, which is also known as the big toe. Auxiliary is in this region, it's the chest. Buccal, which is not on our actual diagram in the book or in the text, but it's actually the cheekbone. Pollux would be the thumb here. Patellar would be the knee bone here. Oral, which is kind of common, would be the mouth. Mental, which that threw me for a loop, would be the chin. Brachial would be the upper arm here. Antebrachial is the lower arm. Crural would be the front lower leg. Stomach is the umbilical area. Of course, there's no stomach in here. This is just the skeleton, but the umbilical area would be here. Femoral would be the upper thigh. And now we're going to actually talk about the posterior or dorsal part of the body for the rest of the items. Back here we have the sural, the calf. The calcaneal is the heel here. The popliteal would be the back of the knee. The olecranial would be the back of the elbow. The acromial would be the shoulder. And the back of the head would be the occipital. And that's right here on the back of the head. So that's some of the anatomical terminology for some of the bones. We're going to go ahead and demonstrate the directional terms here. The head is superior to the sternum. The sternum we know as the breastbone. So superior would be anything above the trunk of the body is superior to the lower trunk of the body. The elbow, which is the olecranon, is distal to the acranium, which distal means that the elbow is actually above or superior to the breastbone of the body. And then we have the axilla, which is the upper arm. And that's going to be proximal to the brachium, the shoulder. And what proximal means is that the shoulder is superior to the upper arm of the body. And then we have the nose, and it's medial to the eyes. So medial, what that means is that it's midline with the eyes. Then we have the sternum, which is the breast, is anterior to the vertebral column, which is in front of. So anterior means in the front part of the body. The vertebral column is actually the spine. So the sternum is actually in the front part of the body. The spine is actually in the back part of the body. And then we have the umbilicus is inferior to the sternum. The patella, which is the knee, is proximal to the torus, which the knee is proximal. The knee is actually superior to the torus, which is the feet. So superior means that it is kind of away from the trunk of the body. And then we have the ears are lateral with the nose. So the ears would be lateral with the nose. And what that means is there's a midline. So it's actually the nose is away from the ears, like going in these directions. So that covers the demonstration for the directional terms. Now we're going to go to the abdominal pelvic regions. So we actually have that marked off here. So I will go ahead and point out all of the regions here. The right hypochondric region is the first region. That's going to be here. And within that region, there's a couple of organs. Those organs that are in that region are the liver and also the gallbladder. The next region is going to be the right lumbar region, and that's going to be in this area here. And within that region, there are a couple of organs, which would be the large intestine, part of the large intestine, and the colon. Those are in that region. And then right below that right region, there's a right iliac, which is also known as inguinal region, and that's right here below. And within that region, there are a couple of organs, which would be the cecum and also the appendix. In the mid area here, we have the epigastric region up top. And within that region, the organs that are within that region are the stomach and then also the ribs. The next region would be the umbilical region, and that's right here in the middle above the belly button. And within that region, the organs are the digestive system as well as the small intestine. And then below we have the hypogastric pubic region right in this area. And within that region, we have the urinary bladder and also the testes in that region, because this is a male model here. And then the next region, we have the left hypochondriac region, which is region number 7. And within that region, you would find the diaphragm as well as the spleen in this region. And then next we have the left lumbar region, which would be that mid-left section there. And within that region, the organs that you would see would be the digestive system as well as the large intestine. And this will be connected to the large intestine on the right side. It's all one organ. And then finally, last but not least, this bottom section would be the left iliac inguinal region. And within that region, we have the sigmoid colon, as well as the lymph node. Okay, so this is actually what the stomach area would look like if we went ahead and labeled the regions as well as the organs within that region. Thank you very much for tuning in, and have a great night.